All right. Hello, everyone. Thank you for joining us. This is our October 2022 quarterly state advocacy webinar. This is a recorded version, so this is not going to be live streamed anywhere, but this is posted up on our EveryLife website. So if you're watching this, welcome. And thank you for joining us today. So we do have quite a bit of an agenda today. We will be joined by Dave Johnson of Faegre MN State GR practice, former state legislator. He will be touching on 2022 legislative session wrap up and 2023 session outlook. And then we're joined by Baillie McGowan, state policy manager here at EveryLife Foundation for some copay accumulator updates. And finally, we have a rare disease advocate, Claudia Fennell, talking about her advocacy experience at the state legislature. So we can go ahead and start with Dave from Faegre, and he will be doing a 2022 legislative wrap-up and 2023 legislative outlook. All right, and Dave, whenever you're ready.
Yeah, thank you, and appreciate the opportunity to join you today to talk a little bit about what happened at the state level and broad strokes in 2022, a little bit about the upcoming election and what that means for 2023. So I think it's hard at the state level to think about outcomes without considering the 2022 election and redistricting. That was a big topic across the country with all states. And, on the minds of legislators, all of whom had to be looking at the decennial redistricting process, what it meant for them individually, and what it meant in terms of new districts, potential challenges and safe districts, those kinds of issues. So they really permeated activity at the state level in 2022 with Minnesota legislatures. Had an impact on the kinds of policies that states adopted across the board. I'm from Minnesota. We have a divided legislature, and so what that meant was everybody was focused on their districts in the upcoming election, and not a lot got done. Even though a lot of states were looking at budget surpluses and having significant federal funding from the federal government with COVID. Other states were able to find some consensus in those areas, but it was really a mixed bag. In terms of the elections, with redistricting, there's going to be significant turnover in 2023. I think that's the first main point I would make about 2023 as you're thinking about your individual states is with redistricting comes significant turnover. Because of new districts, pairing of current legislators, that's a time when you tend to get more challenges. I'll give you an example again from Minnesota. Currently before the election, there are about a third of the legislatures already announced that it's retired or not running again, including some pretty key leadership positions. So that's once the election is done, we're looking at probably 75, 76 new members of the Minnesota House and Senate. And I think you're going to see that across the country where you're going to have a lot of new folks and potentially the ability to have different people in leadership. Coupled with the fact that this is a midterm election and generally midterms are not particularly favorable to the president's party. Being upset about certain policies tends to resonate with the opposition party and motivate their voters to get out in the midterm. So, for the Republicans, that could be a positive. And again, that's a broad stroke, and there are some across the country. It's different in every other state, and there are some cross currents that could make this a little different, particularly the Dobbs decision. But overall, a lot of changes are going to happen as a result of this election. You're going to see a lot of new members in state legislatures in 2023, and that really puts a focus on education, bringing new folks up to speed on legislative agendas, the need for funding, and just understanding that the changes in the dynamics, both in terms of committee membership in committees of jurisdiction, and key champions for particular pieces of legislation. The other thing with 2023, budget is going to be generally top of mind for legislatures across the country, given that it's right after an election and the state's budget is usually set in those odd years, whether it's a state that has a single year budget or a state that does biennial budgets. So a lot of focus will be on trying to drive consensus on state budgets, and to the extent that folks are focusing on policies that have fiscal implications, there tends to be more focus on those types of policies because it's being looked at in the context of a state budget. So budget and taxes will be important. There'll be a lot of activity at the states generally responding to the Dobbs decision. Inflation relief, that's going to be a big issue as inflation continues. I think folks may have seen, for example, that the Social Security Administration is looking at an almost double-digit increase in its COLA as a recognition of what inflation has been doing over the last year, and that has impact on state budgets, both in terms of salary and wages for employees, to the extent in healthcare and other areas you are outsourcing revenue to cover all sorts of priorities. Those costs are going to increase. Now, the good news is a lot of states are still tending to run budget surpluses, in part because of the federal money and how the economy's been doing. But there's going to be a lot of discussion at the state level on inflation, both in the context of the budget and ways to deliver relief to citizens. Healthcare, of course, is always popular, and next year will be no exception. You'll see that in terms, again, of state budgets. There are 12 states that have declined to expand Medicaid under ACA. Those states are always looking at that issue. Drug pricing, that's another big issue that you'll be seeing at the state level. So as folks move forward and are looking at individual states, it's really important after the election to get a lay of the land in terms of who's controlling the agenda, where there are new folks, how you educate those folks and bring them up to speed. Has it impacted your champions on a particular piece of legislation, and then budgetary issues and some of those perennial healthcare issues are what I see happening over the next 12 months and into 2023. So with that, maybe I can stop, and Michelle, if you have a question or move on and be around later, happy to try and answer.
Thank you so much, Dave, for those insights. It's really interesting to hear about the changes that's coming up and some things to look out for. I do have a couple questions for you. From your experience in Minnesota as state legislator, how do states' healthcare agendas get set? There seems to be a lot of general issues that each party takes up in many states, and I'm wondering if you can comment on how advocacy communities can get on the radar of leadership beyond the block and tackle advocacy action in a single state.
That's a great question. I think at the individual level as a legislator, it was always compelling to hear from constituents. So grassroots organization and advocacy is always important, especially with members in key committees, as well as members in leadership. I feel like, I'm a registered lobbyist in Minnesota, work on behalf of clients there, but anything I can say to a legislator is never as powerful as somebody from their district and somebody who, has the opportunity to vote and influence others in a legislator's district. So I think that's in terms of beyond blocking and tackling, really, working those connections in key legislators' districts are important. Working with your partners, if you have them in states, through trade groups and others who may be more involved in assisting leadership on election and political issues, working those relationships would be something else that I would take a look at. So.
Great, thank you. And just one more question. So you mentioned there's going to be a lot of movement going on with these midterm elections, especially when there's going to be some new incoming governors or a new state representation. Do you have any advice on how we can hit the ground running and make sure these new policymakers understand rare disease legislation and how to be ready to act from the beginning?
Yeah, that's a great question. I think, first and foremost is to be ready to go the day after the election, as quickly as possible, do assessments within an individual state to understand what changes have occurred, either with a new governor. I think there are 36 governors up for election this year. And if there's a new governor in a state because of a vacancy or somebody loses, they usually recommend budgets, which is always the starting point. So a good assessment of, what's going on at the executive branch level and the ability to start talking to folks immediately after the election is important. Identifying if there are transition teams, even for incumbents, there are sometimes transition teams, and identifying those individuals in critical areas and to start talking about your agenda right away is important because once they get into session, and again, there'll probably be a lot of new folks that you're going to really want to be talking to. It gets a little harder for folks to focus. And there's a window, which I usually say is, between Thanksgiving or between the election and a week or two after Thanksgiving, at which point I think everybody checks out for the holidays and they usually come back and everybody's right back in session. So that window there is a real opportunity to try and educate folks on an issue, as opposed to what can happen once you get into a state legislative session where people are, being pulled in a lot of different directions, and the analysis is much more high level, or folks are just relying on an opinion leader. So identifying those opinion leaders, identifying key folks, using that time to educate people as in-depth as possible is always helpful as you move into the nuts and bolts of session.
Great. Thank you so much, Dave, for your insight on the session and for the insight on the questions. I really appreciate your time today. And if there's anything else, if any of the advocates watching this recording have any questions, I'll be sure to link over Dave's contact info for anything that he mentioned as well. All right. Thank you again. And next up, we have Baillie McGowan, State Policy Manager here at EveryLife Foundation, to be speaking more on copay accumulators, updates on the state level.
Hi, Rachel and everyone. Thank you for having me. So a quick overview of what exactly a copay accumulator is, because I feel like the word gets thrown around a lot, but it's not always explained and it's a little hard to grasp because it's a really complicated and kind of deep issue, but it is impacting so many real people. So a copay accumulator program is a program that's written into insurance clauses that doesn't count manufacturer copay assistance or any payment made on behalf of a patient towards their out-of-pocket maximum or their deductible. So how that works is the insurance company collects the copay assistance as they normally would when a patient goes to use it. And then when it runs out, the patient is still responsible for the full cost of their out-of-pocket deductible or out-of-pocket maximum and deductible. So it's really hitting people incredibly hard. This is so much money we're talking about, and it is real money. It's not a coupon. It's affecting everyday lives, and people find out about this a lot of the times at the pharmacy counter when their copay assistance is run out. And so then people are left with the terrible choice of rationing medication, of going into debt over it, or foregoing their medication altogether, which is an incredibly dangerous practice. And it affects so many people for so many reasons. So the legislation we're going to talk about is really putting forth, or is really codifying that payments made on behalf of a patient or by the patient count towards their out-of-pocket maximum and deductible. So if we go to the next slide, because I know that's sort of really hard to digest, and it's sort of a how does that work situation. The AIDS Institute did a really great job of depicting this. Oh, and my boxes are a little wonky on there, but I think you can still grasp that without copay accumulator programs, patient pays significantly less than they do with a copay accumulator program. This example right here, it's over $6,000 difference what the beneficiary and what the patient is paying as compared to with a copay accumulator program. And that's linked there for the full study and write-up on it. And I'm happy to answer any questions if anyone ever has them about copay accumulators. I'm certainly not the expert, but I work with many, many smart people who are experts in this space. But if we go ahead to the next page, we can see that about 15 copay accumulator bills have been passed at the state level over the past few years, which I think is incredible. But that's not really the big impact. If we go to the next slide, we can see all of the pieces of legislation that were introduced this year that are either ongoing or unfortunately didn't make it. It's not the full list though. Like in Washington, DC, there's a hearing scheduled for it. It's in the Register. In Delaware, it has been enrolled, which is their way of saying that it's passed both the House and the Senate. And so they just need to get it sort of in one cohesive document to hand to the governor. New York, the bill's on the governor's desk. So there's still plenty of opportunities to get more legislation passed. But I think this pretty massive list indicates how big of an issue this is and how many states are paying attention, and the potential opportunities coming up within the next year to really work on this. EveryLife and Rachel and Shannon, I will shout out really quickly, did such an amazing job at pulling together a rare disease legislative advocates Hill Day, Advocacy Day in Massachusetts, where our advocates talked about this issue. And the bill there didn't move forward and didn't quite pass, but there's another piece of legislation tied to copay manufacturer assistance that did get put forward. It's something that has to be renewed, and it was renewed 2 months later when it wasn't really looking like it was going to. And I would like to think that our advocates who were there and talking about copay assistance really had something to do with that, and people were listening. So there are so many opportunities to get involved in the space. If we go to our next slide, we can see one such opportunity. I was fortunate enough to be able to join the Michigan All Copays Count Coalition at their Advocacy Day just 2 weeks ago. I don't know if it feels like yesterday or 2 months ago. This time of year is going by pretty fast, but the Hemophilia Foundation of Michigan and the National Psoriasis Foundation brought together coalition members and advocates from Michigan to take to the Hill to try to support the bill in Michigan, which passed the House quite a while ago. It's been sitting in the Senate for the last 18 months. So there, everyone took to the Hill and thanked their House members or their House representatives for passing the bill, and asked the Senate members to really call for a hearing and support it once it got there. And I think this was just a really great opportunity and shows that how important patient voices are, because I can go in, and I think David was just saying this, I can go in and say as many facts as I want, but unless I'm a constituent really talking to their legislator about their experience in their state, it's not going to move quite as far. So we're also members of the All Copays Count, like federal coalition and the state coalition. California just started up a state-specific coalition there that we're joining. So we're really looking forward to it and excited, and we're going to keep you guys apprised of any opportunities to join in.
Great, thank you so much, Bailey. And I'm wondering, so for the states who have yet to have action with copay accumulators, is there with the legislative session winding down, is there something that advocates can do in these final months of the legislative session that they can prepare for next session with copay accumulators?
Yeah, so I think I think again this sort of gets at what David was saying, of really getting in the door kind of early. You might have some transitioning going on, so trying to get there early, and even if the bill doesn't exist yet, bring it to the attention of your legislator. Making those connections, even if you don't necessarily know someone in the Hill, you might know someone who knows someone, or you know a guy who knows a guy. And I think that's like a really great way to try to get your face in there, get your name known and your story. And that way, when you start to advocate for specific pieces of legislation, they can connect it back, and there's, some sort of memory there with you.
All right. Thank you so much for that insight on copay accumulators. Really appreciate your insight on all of this, and get us prepared for next session as well. Great. And next we have rare disease advocate Claudia Fennell to talk a little bit more about her experience of advocacy at the state legislature, words. So Claudia, I'm just going to go ahead and speak more on that and a little bit on her story as well.
Hi, can you hear me okay?
Yes.
Okay, thanks so much for having me, and for, I guess, listening to my experience. It's not that scary. And thank you, EveryLife, for getting me involved. So I shared our personal story with CLN Baton disease, which affects our youngest child, Penelope, that you see here. She's 8.5, and I told our story in support of a House bill that was going through the Maryland, first the House of Representatives and the Senate. So on 2 occasions, and I basically connected our real life story to what this was, which was in support of RUS alignment legislation that was passing through those 2 governing groups. And so I told our story, which is in the short version is that Penelope was diagnosed with CLN2 Baton disease. She was about almost 4 years old, and it turned out to be a really aggressive neurodegenerative disorder that showed no signs at all before that. And basically, the natural history of the disease includes really rapid loss of the ability to walk, and all forms of self-care, almost complete verbal loss, and really just dependent on caretakers, and then progressive dementia. So it's a lot in one little child, and until the first and only therapy, an enzyme replacement therapy, was approved in 2017. The natural history of this disease meant most kids passed away between 6 and 10 years old. So Penelope's almost 9, and she's been on this therapy, and our community has really focused on early diagnosis, and newborn screening is really, really important to our group because this enzyme therapy is being used on younger and younger kids. And now I believe the youngest one is 6 months old that's being treated. So we're kind of a really good example of the importance of newborn screening. So that's why I, was able to tell that story and make it really relevant to that specific piece of legislation. So I testified twice and told our story twice. The first session, I was a little bit, I guess, taken aback by the questions about the legislation. And I think as an advocate, telling a story that's so personal, it was hard to hear people ask, well, how many kids could be helped and how much would it cost? And, these kind of quantitative questions that were hard to think about and discuss because it seemed like such a kind of moral issue, not a financial one. But that's how the world works. So that was a learning experience, hearing people ask very practical questions about what that legislation really meant. And then the second, I told our story again for in the Senate committee, and I felt like, again, people were very sympathetic and receptive, but a lot of very practical questions about it and how it would be, how it would affect families, how it would be different than what the status quo is as far as newborn screening. So I think EveryLife, Dylan and did a great job, and the other advocates did a great job sort of explaining those practical aspects of it. But I was really glad to have a personal story to kind of illustrate what it would mean to us, because if Penelope had been diagnosed when she was born, all evidence now suggests that she would basically be living an almost normal life. And so it's very impactful. So you had, Rachel, I think you had also asked me to speak to the virtual format. It seems like that's what people are doing for the foreseeable future. And I thought it was really straightforward. It was more convenient, obviously, than going somewhere. So I think for families that are dealing with medical complexity and the real scarcity of care out there right now, it's a real advantage. And I personally am really happy, and I think it would bring a lot of new advocates out to tell their story if that continued. So, and then I guess I got involved just because EveryLife asked me to tell our story. Another advocate from a different state that was dealing with similar legislation had recommended me here in Maryland. And I think part of the reason that connection sort of worked was that I had maintained, good contact with our national advocacy group, our national disease specific group. And so I guess I'd like to just stress how important that is in terms of recognizing and being able to jump on the opportunities to speak up and tell your story where it's relevant, where it's impactful.
Thank you so much, Claudia. And I was wondering, with your experience, I know it was virtual, but do you have any tips for new advocates who want to build up their legislative experience?
I would just say jump on every opportunity you can to tell your story. I have participated in some of the meetings with local representatives, my congressperson, that were at their home office while Congress was not in session. And that was a really personal way to you kind of learn how to tell this story in a way that's relevant to legislation and to policy. And to telling my story to someone who knows where we're from and knows the area and knows the kind of resources, you know, and challenges of the particular, you know, area where we live. I think that, you know, just trying various contexts, whether it's the Rare Disease Week, or even just even within your own disease group, connecting with other families that want to get involved and mentioning something that you've been able to do like this is really helpful. And you know, it makes it really down to earth and accessible to people that see it as extremely complex, but it's really not.
I'm also wondering, Claudia, what was the day when you were testifying virtually? What did that day look like for you in terms of how did you? I know you prepared by sharing, practicing your story a little bit, but when they were asking you questions, what did that look like for you? Did they single you out, or was this like a big question to the whole group? I'd love to know more about the process of testifying.
Okay, yeah. So I told our story, and then, you know, I think it was very clear that we were sort of an example of why this is meaningful. The follow-up questions, I think my recollection is that they were directed more to the EveryLife people. I think Dylan probably answered some of them, and they were really trying to clarify what the legislation was going to do. So they were more logistical questions in terms of, you know, like how would this make our process different? What budget concerns might there be now and in the future if this is implemented? Trying to get a handle on what it means kind of medically. I was surprised at you know, it really was kind of like telling our story to a group of people that really didn't have any experience with rare disease or with a medically complex situation. I don't think that's true of, you know, but it felt a little like that. You know, it felt like telling your story to people that really didn't quite understand where it fit in. And so the follow-up questions were more about that. And I think there were questions that relating to data and budget and efficiency and very practical questions. I think from a perspective of, you know, a mom of 3 kids and, you know, carpools and buses and everything going on, it was a little bit hard to carve out that time, but it was so efficient, you know, in the sense that you prepare, you hop on, you say your piece, answer some questions, and it, you know, everyone in those meetings is very interested in getting to the point and moving on. That bill was one of many that were discussed in a single meeting. So it was very quick, very fast moving. And in the end, it really wasn't a big time commitment.
Yeah, I think the time commitment might be a lot of constraints for a lot of our rare disease advocates. So it's good to know the process and that it doesn't really take a lot of your time, but it's really impactful to be doing you know, having that experience. And I'm wondering, how has this advocacy experience for you testifying at the state legislature empowered your advocacy journey? Has it moved you forward? Do you think that you had gained a lot of experience? I'd love to know that as well.
So I think I have been a little bit more comfortable telling my story after this experience. I did have to, write everything down and then edit it down. It's an extremely short amount of time during these testimonies to tell your story. It really, it feels like the blink of an eye. And so I think really boiling things down has served me well in a few contexts and has made me more comfortable in situations like Rare Disease Week on the Hill, and even speaking to our own clinicians and new doctors that are new to our team that may not know as much about Batten disease, having like a quick explanation of our story and being able to use that to highlight the importance of different things has been helpful. I think that I'm definitely more likely to volunteer to speak to legislators. I think it just humanizes the whole thing to do it once, and it also helps to understand the process of how. And EveryLife has been really great about this, like kind of educating advocates as to how this works, and so that we have a realistic idea of what the timelines are, who is hearing our story, what's important for them to hear. For example, in my second testimony, I added the fact that I can't go back to work ever because of delayed diagnosis. Like my child requires full-time nursing care. I can never return to the workforce while she's still alive. And the economic impact of that with primary caregivers, if you aggregate all of that, just getting somebody to think through that is really important. So I guess telling your story once makes you sort of listen and realize what you could add and take away to make it more impactful next time. So.
Well, thank you so much, Claudia. I really appreciate your time. And thank you to Dave and Baillie as well for your time for this webinar today. And finally, for the end of this portion of the webinar, I'd like to go over some reminders and some programs that we have. And if anybody has that's watching this right now has any questions, they will be listed. The emails of Baillie, Claudia, and Dave will be listed in case you have any questions you'd like to ask them after you watch this recording. So feel free to reach out to them for any follow-up questions that you may have. So next I'd like to go, so we have our newborn screening boot camp this weekend, October 15th in Tacoma, Washington, in conjunction with the Association for Public Health Laboratories and Newborn Screening Symposium. So this event is designed to educate and engage participants on the latest newborn screening updates and best practices to build relationships between stakeholders from all aspects of the newborn screening system. So you can find more information at nbsbootcamp.org. And a reminder that the 2023 Rare Giving Grant applications are now open. Applications will be closing Friday, October 28th. And for more information on this application, please visit raregiving.org. And as mentioned many times today, the importance of sharing your story can be really impactful. One of the most powerful ways that we can change policies that we're talking about today. So we launched What's Your Story, which is an online rare disease story bank for advocates to share their experience on a wide range of issues in one place and in one stop. So everyone is invited to share their story. You can go to everylifefoundation.org/story. We'd love to hear your story. You can even upload your photos and videos, which can help illustrate your story as well. The stories that you submit will be used in a variety of ways. They may be shared during meetings with members of Congress. And if we have a story from a constituent of theirs, or we might share it on social media or on our website. So feel free to share your story. We'd love to hear from you. And finally, a reminder that the next RDLA webinar will be on Thursday, October 20th, 2022 at 9 a.m. Pacific, 12 p.m. Eastern. If you have any questions, please email my colleague, Caitlin Laws. Her email is listed down below. This month's webinar will include a panel of experts in DC to speak on the impact of the election and the healthcare legislative outlook for Congress for the rest of 2022 and the new Congress in 2023. You can register for this on the RDLA website. But I'd like to thank again all our speakers, and thank you so much to the RDLA community and the rare disease community for your time. And I hope this webinar has really helped you and has been impactful for your state advocacy initiatives. So thank you again, and I hope everyone has a good rest of the session. Right.